there, class. Sorry I couldn't be there with you guys today, but I have put together these slides and I'm going to talk about them. I did research on Canada's healthcare system. Alright, let's get started. So, first off, Canada follows the beverage model, which is a single payer insurance, public control of healthcare provision, and it basically means that healthcare is available to all patients and it's for free. They see healthcare as a good that is provided by the government and it is paid for with tax revenue. A major value of this model is equity and equal access to care regardless of the ability to pay. It is named for Sir William Beveridge, which he formed this model for the UK after World War II. This is a direct quote from Canada's website discussing their healthcare system. Universal coverage for medically necessary healthcare services provided on the basis of need rather than the ability to pay, which is the whole purpose of universal healthcare is providing need regardless of someone's ability to pay and their income levels. Something interesting that Canada uses is they all have a health card that looks like this. You have to be a permanent resident of Canada, an authorized refugee or protected person, or a non-resident that's been there for over 6 months. Uh, you present this card each time you are receiving care. Values of the Canadian healthcare system include fairness, equity, Canadians' willingness to share resources, and another value is their continuous improvement and modification. This is a big one for them as they believe in continuing to modify their system as changes and laws change throughout the years. Also, another value of Canada that I would like to mention is their legality of advertising directly to customers. Here in the US, we see lots of advertising in commercials on the street for drugs. For instance, Ozempic, they literally have a jingle that we hear. This is almost illegal, but if not tightly monitored in Canada, as you must sell directly to healthcare providers and doctors rather than to consumers. The agenda for the rest of this presentation is history, major players, finances, discussing moral hazard and adverse selection, as well as the pros and cons. There are some additional slides in here, but these are the main categories. First off, let's get into the history of Canadian Medicare. We have the Constitution Act, which happened in 1867. Which is where the provinces were responsible for establishing, maintaining, and managing hospitals, asylums, charities, and charitable institutions. Um, then we get to 1919, Department of Health was created, and before World War II, healthcare in Canada was for the most part privately delivered and funded. We see another major timeline event in 1947. Saskatchewan introduced universal healthcare province-wide. And then we have 1966, the Medical Care Act, where you were offered to reimburse or cost share one half of provincial and territorial costs for medical services provided by a doctor outside of hospitals. Within 6 years, all the provinces and territories had universal physician services insurance plans. In 1984, we see the Canada Health Act. This legislation replaced the Federal Hospital and Medical Insurance Acts and consolidated their principles by establishing criteria on portability, accessibility, universality, comprehensiveness, and public administration. They also added concepts that prohibited extra billing and user fees for insurance services. And then basically from 2003 to current times, Like I said prior, a value of theirs is reforms and modifications. So since then, we've seen lots of reforms and adjustments to the system. Major players include the federal government, which they set the national health policies, provide funding to provinces, and they ensure adherence to the CHA, which is the Canada Health Act. Then we have provincial governments. They are responsible for administering and delivering healthcare services within their jurisdictions, of course, and kind of how everything is organized within their regions. Then we have healthcare providers, which includes our professional care, like physicians, nurses, the hospitals themselves, and clinics. Another key player are, of course, the patients who receive the care, and their wants and needs are what establishes the system and maybe calls and stands up for reforms and changes that they need. And then we have insurers, which play a role for areas not covered by the public system, for instance, dentistry or prescription drugs, eye care, maybe cosmetic services. Moving on to finances, the system is decentralized, universal, and publicly funded, which means the government pays for it. It's funded through taxes like income and sales tax. Canada is known for having high tax rates. We also have the Canada Health Transfer, which is the largest major federal transfer to provinces and territories. It provides long term predictable funding for healthcare and supports the principles of the CHA. And patients typically do not pay out of pocket for medically necessary services. For instance, going to the doctor for a checkup, you're not going to pay a copay of $20 or $40. It's free if you present your health card. Also, an aspect of finances is price controls. When you are needing prescription drugs, these are negotiated with drug companies. Some interesting graphics I found is that Canada spends $264 billion on healthcare, which is averaged $7,000 per Canadian citizen. And then we see on the right here this pie chart sort of thing separates how the government pays for this insurance or how healthcare is covered, with majority being 64% government covered. Now getting into moral hazard and adverse selection. Moral hazard is when people are in the health world are using more services than they need because they aren't the ones facing the total cost. For instance, if health insurance is free, why wouldn't you constantly make sure your health is at a proper level since you don't have to factor in the cost of it? This is a problem for universal healthcare because there really isn't a way to fully get rid of this. Uh, but the way Canada solves this is maybe adding in copays, deductibles, gatekeeping, coverage limitations, for instance, cosmetic surgery, dentistry, eye care, those sort of things. They have a large emphasis on preventative care and also the Common Drug Review, which is a cost effectiveness analysis process regarding prescription drugs. And we see on the left here this graphic showcases moral hazard. Since they have universal coverage, Canada's should be at full with helpful, but since that is not optimal because of extremely high tax rates, it is more beneficial to be where beta is because there is a trade off there for wait times, high tax costs, and um, people maybe receiving less care, but it is an effective trade-off. Also, let's discuss adverse selection, which is when people that have higher risks are more likely to enroll in health insurance and the cost for insurers were to increase. Canada's system actually solves this problem because they provide universal coverage to all people, regardless of your health level, income level, all the things. Now let's look at the pros and cons of this system. The pros is that the basis of it, it's more accessible to all demographics because of their universal coverage. It reduces additional expenses like out-of-pocket costs, and it addresses social inequality. Some cons are the high taxes, potential for high wait times. They are experiencing a shortage of healthcare providers and a lack of investment in medical technology. This one's quite interesting because they focus on basic care for all. Um, and now, I thought this was quite interesting. This is a graph I found on the textbook that showcases health inequalities among Canadian children. Um, Basically, the rich versus the poor. And you can see that in this graph, we see that infants born to poor families in Canada are nearly twice as likely to have poor self-reported health than those born to rich families. And then we also see this gap drastically widen after age 10. It's quite interesting to see that the whole basis of their system of closing the gap between the rich and the poor in their healthcare, um, there's still a large gap. Something I also thought was interesting, but what if you're visiting the country and you need care? Is it free for you too? Surprisingly, no, it is not free. You must pay out of pocket. The government of Canada does not pay hospital or medical bills for visitors. And through the the websites I found, they say that you should highly consider travel insurance if you plan on taking a trip over there. And also, Canadian healthcare providers do not accept U.S. domestic health insurance, so you will likely be paying in cash. Something to conclude this presentation is another thing I found in the textbook, which was a 1999 study surveying respondents in Australia, Canada, New Zealand, the UK, and the United States. And they found that a majority of people in each of these countries were dissatisfied with their country's healthcare system. And between these countries, they all experience different, it includes the different healthcare systems. Um, Basically, the rich don't like waiting, which is something you would see maybe in Canada, and the poor don't like high prices, something you might see in U.S., and the middle complains about both. Um, and like in the textbook, they say that this doesn't mean that the systems are necessarily bad or that people in government positions are doing a poor job. It's just that healthcare is a difficult subject, and it's difficult to manage all the different wants and needs of the system and a country's needs. Thank you guys so much for listening. Again, sorry I couldn't be there with you. And I look forward to being back in class. And yeah, thank you. Bye.